Your heart is a muscular organ that pumps blood containing the oxygen and nutrients your body needs. The main pumping chamber of your heart is the left ventricle. When your left ventricle contracts, it sends oxygen-rich blood to your body through a large...
So inside the heart, we typically have two upper chambers and two bottom chambers. And the normal heartbeat will start here in the right upper chamber with electricity coming out from that source across the top chambers. And then it should merge again to where one wire called the AV node allows electricity to be carried then into the bottom chambers. And most of us are born with that one single wire. But there are people who have an extra wire, and that extra wire we call an accessory pathway. And it can be in lots of different areas of the heart, but over on the side of the heart, sometimes in the center of the heart, or on this side. And that extra wire then allows electricity also to sometimes be carried down into the bottom chambers. It also kind of creates the ability for electricity to move down our normal pathway and short circuit up that extra wire and get stuck in a little loop going round and round like a dog chasing its tail. And as a result of that can make people's heart race and feel symptoms. Mm-hmm. Dr. Dean mentioned that you've had some periods where you feel like your heart takes off and races on you.
Yeah.
Some, and if that's the case...
So it's like a... Did you just mention dogs?
Yeah. Well,
Is that why they call it a Wolf Parkinson?
It's called that because there are actually three doctors, Dr. Wolf, Dr. Parkinson, Dr. White. Oh, okay. Parkinson was the one who discovered Parkinson's disease as well.
Oh. Well, how does that have to do with... I guess they're mixed breed.
Yeah, mixed breed. But essentially, just this rotation of electricity is what gives people that feeling. Okay. And so when the heart gets stuck in that loop, it feels like your heart's just beating fast in your chest.
Right.
Typically is a nice regular rhythm. It's regular, but it's fast. It can make people feel lightheaded, dizzy, weak, short of breath.
Yeah, I've been there. I just...
And it usually starts very quickly, and then also stops very quickly.
Well, not for me.
And what does it feel like for you when it stops?
Sometimes it takes for hours, and
then
sometimes days.
Does it seem like it eases off when it stops?
If I take really deep breaths. Or
something like that.
Yeah,
And then, but will it suddenly seem to go from beating pretty fast to beating normal again?
Yeah, if I pound on it
hard
enough, or take deep breaths and just
hold.
Is there a certain technique to
There is. So some people are able to what we call vagal themselves out of these rhythms, and so there's some vagal maneuvers, and vagal means a vagus nerve that is in our body gets kind of activated when you make a certain maneuver, and that causes the heart to slow down and break people out of these rhythms. Okay. So the most common vagal maneuver is what we call Valsalva. It's where you take a deep breath and push down as if you're trying to have a bowel movement. And you push out with your abdominal muscles, and you increase tension, basically pressure inside the chest. Mm-hmm. That stimulates that vagal nerve activity, slows the heart rate down, and breaks people then out of the rhythm sometimes.
Yeah, that's what I discovered on my own that works, because I try everything.
The other thing that occasionally people will do, and sometimes they do it naturally, but is coughing. Coughing really hard will sometimes be able to break you out of that rhythm. Mm-hmm. The third that I recommend at times is to dunk the face in cold water, or put cold water on the face will often kind of jolt that system into effect as well.
Speaking of coughing, would marijuana help with that? I mean, like coughing and...
It could. So marijuana is sort of a relaxing agent. And so as a result, it could kind of help to reduce catecholamines or stress that induces a lot of, adrenaline-like behavior that sometimes happens during these events. So by blocking that in some regard, that can sometimes reduce the event rate if it's occurring. So some people I know have gone to that, or even alcohol or other kind of medication or other things to try to self-treat themselves when they start having this behavior.
Okay.
Yeah.
Thanks, Doc. You're very honest.
Yeah. I think that that when we see these kind of patterns on the EKG, though, with the EKG, what I'm able to see is that electricity flows in your heart down your normal, but also sometimes down your accessory pathway. And I can see that behavior on the EKG with what's called a delta wave, a little early activation of the ventricle that exists in the setting of sometimes those little extra wires. when we see that present on EKG, and you give me this history of having had your heart raised, then the guidelines would recommend that we then consider doing an EP study, an electrophysiology study, and an ablation, where we take a little catheter inside the heart and try to just get rid of that extra wire. And by doing that, we free you of this event, and we cure the ability for it to have those heart racing spells.
Okay.
So let's go through that a little bit, because although that makes you nervous to think, okay, you're going to do what?
Will it affect my love for?
Yeah.
Would it affect my love for? I guess people, compassion or whatever.
No,
okay.
It doesn't.
It's just a physical.
It's a physical thing.
Okay.
So what it is that this little extra wire that you're born with, you shouldn't have been born with it.
I shouldn't have.
And about 1 in 100 people will have one of these little extra wires.
Story of my life.
So it's a pretty normal.
Is it normal or abnormal?
It's an abnormal to have that extra wire,
Uh-huh.
but it's not a very rare thing to find. Just a number of patients have them.
Okay.
And if you have that and the racing spells, then we'll generally fix or cure those.
Oh.
Ablations have been out since the 1980s, so most of the time we ablate anyone who has this pattern on their EKG and cure them of this if we can. And probably about 90% of them are fixable. About 10% of the time we find that those wires are over or very near our normal conduction system in a way that would put you at very high risk of us injuring the normal conduction system as we fix it. If we saw that kind of pattern, typically I'll just stop, and we'll just bring once you're back out in the recovery area, you and I can talk about the fact that it was a high risk pathway, one that I felt like was too high risk for you. If we were to go ahead and ablate that, then there could be a pretty high chance of having or requiring a pacemaker to beat your heart. So at that point, we usually just stop and say, okay, we might try further medical therapy over that approach first, and if that's not effective, then we could always come back and ablate, taking that risk into account. Okay.
Okay.
But I would tell you, 95% of people, we can ablate it and fix it, and it's gone.
Yeah.
To walk you through a little bit about,
to ablate, you have to go through the.
we go through the leg. So
That's what I have questions of, because
so I'll talk
my legs are abnormal too.
Yeah. So what we'll typically do is we take you we set up a date. You come to the hospital. So I'd say that we bring you in that morning, and we bring you in pretty early the morning of the procedure.
Okay.
Usually 6 or 7 a.m. sometimes to have you there. Then you're there usually throughout the course of the day, because you'll have to lay around for several hours before you can really move much with those little tubes in the legs. Once those are out, we usually watch you down for about 6 hours. So the option is either to kind of keep you throughout the day and let you go home that evening, or usually by like 6 or 7 o'clock, or we can watch you overnight and let you go home the next day. It's easier for somebody to come back and pick you up at that point.
Okay, so somebody they don't need to stay there the whole day.
They don't have to stay there all day.
Okay.
No.
Right, and I'll be under medication.
You'll be under the sedation just for the procedure part, so you're down for usually about an hour to 2 hours for when we're doing the procedure, and then afterwards you wake up pretty quickly. It's pretty short-acting medicines that we use. Okay. So where you're laying there in the afterwards, you'll be awake and talk and be able to eat and that sort of thing.
So yeah, the medication, it's good stuff, right?
Yeah, it's pretty good. We often call it the Michael Jackson drug. That's what he took to help him sleep, was propofol. So that's what we use to help sleep people, and it's the best sleep of your life, as people often say.